across to my panel to discuss what we're seeing today. Dr. Shashank Joshi, member of the COVID Task Force of Maharashtra, is with us on the show, as is Dr. Gangakhedkar, former Head of Epidemiology at ICMR, Dr. Ramanan Laxminarayan, Director of CDDEP, on the show this evening, as is Niranjan, Hiranandani, co-founder and MD of Hiranandani Group. Welcome to all of you and thank you for speaking with us today. Dr. Joshi, not too many changes for the people living in this state right now from what we've seen over the last few days?
No, I think there were a lot of restrictions already in place, and these have been further restricted because one has to balance economy with the disease. And obviously, decisions like lockdown have to be mindful because worldwide we have seen the aftermath of the lockdown related issues. So obviously, looking in all that in mind, I think the administration has been very mindful of the fact to ensure that our first priority is to handle the pandemic, which is like a tsunami, which is hitting the state where the healthcare infrastructure is under a huge strain. At the same time, whatever is necessary and correct and appropriate and is permissible has been allowed.
You know, just as more and more information is coming in, private vehicles, including private buses, can ply only for emergency purposes. So there are specific reasons why you can exit your home right now if you're not able to work from home. Dr. Ramanan, I just want to get your very quick take on the kind of restrictions that Maharashtra has put into place. And I think today there is a lot of interest from across the country, not only those who live in Maharashtra and Mumbai or Pune, etc., because it's a test case, isn't it? It's the state with the highest number of infections, and it's going in for restrictions that others may have to follow, looking at the spike of infections there.
Right, Tamanna. So as we've discussed before, Maharashtra happens to be in the limelight because it's a large state, high levels of urbanization and a fairly strong health system and high levels of testing, which is why the case numbers seem high here. But I think this situation is playing out in other parts of the country as well. Now, these sorts of restrictions have two functions. One is they actually try to restrict transmission, but I think given where the epidemic is right now, that effect is likely to be fairly limited. Stopping people from going out at night is not necessarily going to stop a huge amount of additional transmission. It helps some, but not a lot. The bigger impact of these restrictions is to signal from government to the common man that this is a serious situation. We're out of oxygen. You have to take care of yourself by protecting yourself by wearing a mask and socially distancing. And I think that message is really important. That was a message that the last lockdown, remember a year ago, this sort of shows why we needed that national lockdown. If we'd not had that national lockdown, we'd be facing this kind of a tsunami, exactly 12 months ago. But clearly, we haven't really learned the lesson in terms of self-protecting, but these restrictions emphasize that message, and we need to, as individuals, take measures to protect ourselves.
In Maharashtra, at least people have already got the message. You're possibly seeing them in the number of cases also coming down very, very gradually. So what are these additional restrictions going to achieve? Niranjan, Hiranandani, from an industry perspective, do you think that these were unavoidable? And how do you see this impacting sectors which have just about to see a flicker of life in the last 3 to 4 months?
Tamanna, what the Chief Minister has done is probably the only possibility that was there. Hospitals are chock-full. There's not a single bed in my hospital available today. So the situation is quite severe. Number two, as the Chief Minister said, there is not enough oxygen for the patients over there. So I think that's another signal which has happened. The third, that the lockdown this time is very different from the one which was there at the earlier time. Namely, a lot of activity like essential activity, some of the places where people are doing construction within the campuses, within the situation, within the factories, are all being permitted to carry out economic activity. However, the places where people are like to gather together, those apparently are being restricted completely. Offices also have very, very restricted unless they are essential activity. But the biggest difference that I see now at this time is that those people who had gone hungry, those people who had no food whatsoever to do are going to be taken care of. That social part of it was not there in the earlier lockdown, and I think that's the major difference. So the economic side of the lockdown, which hurt the poorest of the poor, is being taken care of by the government, and I think this is the major difference that we see. All the other restrictions will be necessary till we are able to stabilize the numbers and then really get it on. Two other things which are very significant. The earlier time we protested that you should not lock down the public transport, namely the trains and the buses. So within reasonable amounts, he has stopped that, but he has further put a different sort of restriction, which is that when you use private transport, you can only use it if it's for a specific cause and purpose. I think this is also a major difference that I see from the earlier lockdown to the directions in which we are getting as far. What is not mentioned by the Chief Minister, and I'm quite surprised that he has not mentioned it, I would have mentioned it if I was in his place, was the fact that we don't have enough vaccination. And I think that is something which is very significant, and I'm surprised. Because what we don't have is enough vaccine to treat each and every person. And this is something which is absolutely essential. I find that those people who have been vaccinated may get
No,
COVID.
we'll come to that.
But, I'm
yeah.
okay. All right.
We will come back. We'll come back to the point of vaccinations. We'll come back to the point of vaccinations because this is something that has been taken up extensively at the central government's point of view as well, which is why in the last 24 hours, you've seen a green signal to the Sputnik. And today, the government saying that they will allow foreign-made vaccines to also be procured and sold in India, which opens up to Moderna, Pfizer, J&J, etc. So that is a known issue which was brought up last time as well. I want to focus on the restrictions part of it because everyone's been watching very closely to see this, as I mentioned, as a model of what happens next. So, Dr. Gangakhedkar, let me come to you. So, we know that these relatively severe restrictions will be on for the next 15 days. We're still going through the guidelines and telling people exactly what that will mean. And remember, local authorities have also been given the power within the state to impose specific restrictions that they require. Is 15 days then enough to bring down the rate of infections that we're seeing in Maharashtra, for example, to then lift these restrictions? My question to you essentially is, are we going into this with clarity on what the outcome will be at the end of 15 days, or is it a shot in the dark at this point?
No, I don't think it's a shot in the dark as one would like to describe. I also know that it's not an easy decision. It's also something which requires a great balancing act because you don't want to harm the health outcomes. You also don't want to harm the economy per se. If you actually look at what he has done, perhaps you might find that the number of cases may still increase in first 4 or 5 days of this kind of restrictive approaches that we have used, mainly because people will be staying at home. Those we know people tend to be efficient transmitters when they stay at home, especially in circumstances where the safe distancing is not possible. All of them are staying together with the family and they eat together. Now that's going to be an issue. There were two issues which I felt were distinctly different. The first one to my mind was, we never heard a tone that I am trying to push you into lockdown. Actually, his tone was, a conciliatory kind of thing, that I'm not left with any option. I need your support for the same. I think if you want to bring in an element of community involvement, you cannot be telling the people that you were wrong, you have done something wrong. No, that kind of approach was absolutely not seen. And that's something which is a really nice thing to observe at this particular point in time. Now, when we talk of 15 days as a period, as you said, 15 days as a period could perhaps be really useful at this point in time to ensure that the healthcare infrastructure would have lesser caseload, and it also gives you a time to expand your own healthcare system by ensuring that right kind of patients tend to get admitted in the hospital, the monitoring component improves, and the CCCs, where the asymptomatic people and those who may require oxygen could perhaps be built up within that particular period. Now, I also heard that people were worried that diagnostic tests are getting lesser. I'm little surprised that perhaps we could have added one more component, that unnecessary restrictions that RT-PCR has to be done, to move from one place to another could have been completely stopped. We need to use whatever capacity we have to the best possible way by unnecessarily not utilizing those RT-PCR tests for travel at this point in time. The second issue is we could have also focused on providing rapid antigen tests to people to find out at earliest enough to ensure that the chain of transmission within the family can be reduced to a larger extent, mainly because it takes very little time compared to RT-PCR as a turnaround time, and that could have been inbuilt. But I think I'm sure that there would be a lot of discussions, there would be differential strategies that would be adopted. And the last issue which I would say, which I liked the most, was decentralization that came about, because it is not a straitjacket approach that he talked about, but he talked about empowering district administration to take steps as they require in terms of support, in terms of activities that they would like to do in addition to what has been prescribed. I think this is a very good step. It is not harming as much the industry or the economy. And I'm sure it would be monitored so closely that if there is anything that perhaps appears to be causing a damage on either of these fronts, we would change those strategies. And this should become an example for rest of the country. Rest of the country should also watch as to how you will have to battle tomorrow.
Yes, let's keep this moving. Let's keep this moving, gentlemen, and get everyone's views in, and so then keep our comments pithy in that sense. Dr. Joshi, just a couple of specific things that we want to point out to. How are you going to ensure that people largely stay indoors? That's the purpose of this. And in terms of what has been offered, rice and wheat and all of that is fine. But do you think we could have seen more in terms of support for people whose incomes will be hit? Also, the question I asked earlier, do you think that this time period will be enough to reduce infections?
So I think three things are very clear. No time can be enough, but we have to solicit cooperation of people. At least people should self-realize, and they must self-realize that there is zero tolerance internally for them not to follow COVID-appropriate behavior. They have to follow COVID-appropriate behavior. There is no choice. And now they have to sit at home. So that's a consequence. Now, it's not a punishment. It is something which we have all been responsible, reckless, and not behaved appropriately. So it's a collective wisdom. That is the first thing. The second thing, the CM, as Dr. Gangakhedkar rightfully said, was reconciliation. He is even now appealing to people to behave themselves. There would be economic aftermath. They have tried their best to mitigate that as much as they can within the capacities and the availabilities. So I think there are enough voluntary organizations, NGOs, which will also support the people who are not covered by that ambit. There can never be an upper cup. So that's something which a tight balancing act has been done. They have been very, very mindful what happened last time. With those lessons learned of last year, they have tried their best foot forward. But I still beg and appeal to every individual watching this program that please, COVID is here. Whether you had COVID, whether you have antibodies, you had one vaccine, two vaccines, you have to mask or double mask with distance. No questions asked. It's an airborne aerosol droplet disease. And we need to protect ourselves. And we are in a warlike situation, with a grim situation. And therefore, other thing, as Dr. Gangakhedkar said, is it's a decentralized approach. Local authorities in their local geographies can take a decision of a mini unlock, mini lock, a little more, little less. So that empowerment also has been done. Just like in Mumbai, the war is being fought in the war rooms. In Mumbai, the last 4 days, the test positivity rate from 28% today is down to 16%. We are testing 50,000 cases. We are not compromising on anything. And each ward room of 24 wards of Mumbai are behaving like as if Each ward officer is like the municipal commissioner. He's fully decentralized and empowered to take decisions. So Mumbai is at least seeing a semblance of plateauing now. Similarly, it's the time that everyone wakes up and ensures that we break the chain, and we ensure that we break the chain of transmission. 15 days may not be sufficient, but definitely will dent it.
Dr. Ramanan, let's look at the kind of restrictions and what impact it will have on economy as well. I know that's not the most important thing on people's minds right now, but this is what has a lag effect for months later. So now, for example, it says e-commerce services are also restricted to essential services. That hits a whole plethora of retailers and industries in a very big way as far as demand is concerned. Do you think that we will see a larger impact than is expected over the next 2-3 weeks?
Well, to be honest, Tamanna, I'm not, I didn't understand all of the details of what the restrictions were. But I think, as the other panelists said, there's been a strong attempt to balance the needs of the economy with the need to communicate that COVID is serious and people need to stay inside. So I don't think it's worth second guessing that part of things. I think the fact that, for instance, the one that I picked up was that factories that take a long time to restart, that they are exempt if they can keep their workers inside. Now, that's a really smart and good move. That means that someone has thought about these things. And the fact that flexibilities have been provided. A year ago, flexibilities were not provided because it was simply unclear where the disease was, and the local district administrations didn't have the experience to deal with the disease. Today, every district knows how to deal with the disease, and they know what works for them within their district. So I suspect that even how the rules have been written, they will be interpreted in the local context. It makes sense to do it in some parts which are heavily populated, where there's a risk of infection. And I'm sure in other parts of Maharashtra, it will be interpreted differently as well, as it appropriately should. So, I agree with the other panelists. This is really the only option that was available from a public health standpoint. And I think the Chief Minister has done the right thing here.
That's what we have to ask ourselves, that a year later we're going back to the basics. We're still back to a situation where a lockdown or a semi-lockdown or a partial lockdown or whatever you may call it is the only way then to restrict a spike. And we have to ask ourselves if we've sort of slid a few paces behind in the fight against COVID-19. Mr. Hiranandani, do you have any clarity on, the restrictions which are there for manufacturing? For example, in real estate, can you continue construction work? Are you clear about that at this point?
Yeah, two things have been clarified. I mean, I haven't read the notification because it wasn't out when we started speaking. But I'm told that construction workers who are there on the site, on in situ, and are looked after there, and you are looking after the social distances, getting them tested, and looking after them completely, will be permitted. Similarly, factory workers who are coming within the factory and staying at the site or in a colony from which they are moved and transported to specific short distances will be permitted to operate. So all these factors have been taken into consideration at this time of this particular lockdown, which is different from the earlier one. So I think both the things have been taken into consideration. So the migration which took place last time will not take place this time. Of course, some of the workers who are temporary workers in hotels, restaurants, etc., and those who are actually working on the streets of Mumbai or Maharashtra, other places, obviously are going to get affected. But they are going to be taken care of temporarily or partially with the food security of shift lunches or dinners, which are going to be given to the workers. So I think they have tried to take care of it so that the labor will not go back in the migrant manner in which they are. However, to some extent, it will continue. So I think the Chief Minister has balanced it extremely well from what I read up till now, though I haven't read the fine print. But I think a very, very balanced view has happened over here. But the major thing, which is different from any other lockdown which took place, was that in the urban areas, for the first time, payment is being made in terms of giving food and other facilities which would be given to the people, which has not happened in the earlier lockdown. So I think that's a new one which has come over here, which I did not see in the earlier lockdown. And there was a lot of things that in the rural areas, you had Manrega to take care of it, while in the city level, people who are without work were not getting anything. But why aren't you talking about vaccine?
Many would argue, but many would argue that this is simply not enough. This is simply not enough because a year later, what are you giving? You're giving meals, 2 lakh meals for free. You're giving 3 kilos of wheat and 2 kilos of rice. And those who are eligible, you're giving 1,000 rupees for the month. The fact is that many people will go starving. Mr. Hiranandani, since you mentioned this point 2 times,
Yes,
I thought
I
it's
agree
important
with
that
you,
we
but,
counter and ask,
I-
is it really enough? A year later, you're back to lockdown, and the flip side is just something very, very basic.
Yeah, I agree with you entirely, Tamanna, that it's not enough. And there are many sectors, including the media. They've talked about closing down shooting, films, serials, ads, etc., also going to be closed. That means all the people working in these areas also are going to be affected. And obviously, the 1,000 rupees per month is certainly not going to be sufficient enough to take care of any of those people who are affected by these industries. So I don't think that we are going to make it all. I don't think the government even has the resources to do so. But I think somewhere down the line, a balancing act has been tried, at least for the poorest of the poor.
Okay. Dr. Gangakhedkar, I just want to ask you a broader question about lockdowns, because a lot of focus and an inordinate amount of focus sometimes is on Maharashtra and Mumbai by the national media as well. Perhaps it's because it's the most infected state. It's also an economically very strong state. So what happens here impacts the economy, etc. But is this something that we will have to see, in your view, in other areas where infections are spiking terribly and are right now perhaps underreported?
Yeah, I think this is an example, as I kept said in the beginning. All the states have to watch, because this kind of a situation is almost unavoidable in the state. All of us have to remember that there were only about 50, 100 odd cases that occurred in Wuhan, and now the entire world has produced so many crores of cases just out of those small number of cases. To believe that this infection is not going to come here, to believe that I don't have to prepare for this infection, how I would manage once the infection reaches here in larger numbers, would be incorrect. I think if they have to learn the lessons that Maharashtra is learning, they need to ensure that their diagnostic capabilities have to go up. Because unless you diagnose this infection, you won't be able to isolate. And look at the numbers of tests that are actually taking place in places where the number of cases that are reported is small. All of us have to look not at the current situation, but what is the future, at least short-term future, and plan accordingly. So to my mind, that boundary would be slightly different. It is time that as a nation, we have to work on guidelines that could come based on where the outbreak is more severe, what would I do? And wherever the outbreak is less severe, what all is expected to be done in those areas as such?
What
because
would I do?
it is only
It's a moving target.
approach.
Absolutely right, Dr. Gangakhedkar. We're in the middle of a situation where it's perhaps, we were lulled into a sense of security over the last few months. We're in the middle of the next phase of this war against COVID-19, and it's a moving target. To bring down the number of infections, we will have to act accordingly. Thank you so much to all of you for joining us on this analysis of what was announced in Maharashtra this evening and what it means for the rest of the country. We'll take a very short break, but on the other side, a conversation coming up with Dr. N.K. Arora on the new vaccine candidates and by how soon we can get them in India.